Hello, my name is Amelia Brinker, and this is my persuasive speech on residential treatment facilities and why they don't work. First off, let me just apologize for my lack of audience. We had an unexpected death in the family, and we actually just returned home from a funeral not too long ago today. So I didn't really feel it appropriate to ask anybody to be an audience at this time. Why I chose this topic is because I currently have a 15-year-old child who is in a residential treatment facility. She's my only daughter, and she's also my youngest child. Some background. I'd say around the age of 13, she started displaying some different types of behaviors: habitual lying, superficial self-harm, where she would scratch herself mostly from the elbow down, and then she would go to school and show all of her peers and the people around her. These incidences were very few and far between, but they did occur. So by the time she hit her 9th grade year in high school, she started the same behaviors at high school. She would scratch herself from the elbows down and then go to school and show her peers and her teachers, just people she was around. Now, while typically cutters cut for a cry for help, it seems as though my daughter was doing it for a cry for attention, which is still a cry for help as far as I'm concerned. So the whys really don't matter. But I think for liability reasons, the school suggested I put her in a day treatment facility, which I did. Basically what a day treatment facility is, it's a residential treatment facility who also offers day treatment. Basically, my daughter would go from 8 in the morning until 4 in the afternoon. She was given group therapy, just like the residents, as well as individual therapy, and then sometimes family therapy. Although they would tell you family therapy is a very important part of the treatment, it's not really prioritized that way. So what are residential treatment centers? Residential treatment centers are facilities who are geared toward the treatment of children, but mostly adolescents, with behavioral, mental health issues, emotional issues, and sex offenders, and other types of issues. Sometimes they're juvenile delinquents. What types of programs do they offer? The modes of treatment vary from center to center. However, there are some of the same characteristics, such as group therapy, which gives the youth opportunity to talk with other youth, relate to the other youth, which helps them identify and or learn to deal with their own problems. And it also helps with interpersonal relationships. They also have the individual therapy, which obviously helps them deal with their emotions, identify their emotions, and utilize them in their environment. What issues do residential treatment facilities treat? Substance abuse, behavioral issues, mental illness, such as post-traumatic stress disorder, depression, anxiety, dual diagnosis, and sexual addiction, sex offenders. However, these facilities are reluctant and usually do not give a diagnosis. I'm not 100% why that is. While residential treatment seems to be increasing in popularity, and each center clearly defines the issues they treat, it's unclear how many children placed in these facilities are actually receiving the treatment. Obviously, the center will tell you they're providing the therapy, the group therapy and whatnot, but when you talk to the children, such as the case with my daughter, she says she's not being provided with the individual therapy, and I know from personal experience, we are not being provided with the family therapy. So according to the Alliance for the Safe and Appropriate Use of Residential Treatment Coalition, there are over 50,000 youths housed in these facilities nationwide. Most of those children do have mental, emotional, behavioral issues, but they are not actually receiving treatment specific to their needs. It's more of a generalized type of treatment, meaning that group therapy doesn't focus on one issue, but rather a generalized type of treatment. Where my daughter is, there is actually a program for sex offenders, uh, but the sex offenders there are actually all mainstreamed. And the staff that are supposed to provide um, day-to-day care for these children, safety issues, supervision, don't always do so as well as I think they could. Case in point, my daughter was actually able to get a hold of glass, chew it, swallow it, um, and then of course she was taken to the emergency room, but I wasn't notified until 7 hours after the fact. There's an issue with that. And then also she's cut herself more extensively than she ever has before. She's been able to get a hold of glass and other sharp objects more so than she did when she was at home. And where her behaviors were few and far between at home, maybe once or twice every 4 to 6 months, they became daily over here. So she's escalated in her behavior, and she's cutting herself more extensively than she did at home. Residential treatment facilities are not adequate alternatives to conventional treatment. Level of care is geared more toward the general population rather than addressing the individual's specific needs. There are very few trained counselors, therapists, and psychiatrists per child, so they're not seeing them very often. They're actually relying on the staff to provide basic supervision, things like that. Let me just say the basic qualifications of these staff members, who are the ones that spend most of the time with these children, is the requirements are you must be age 21 years or older and you must have a high school diploma. That's all the qualifications needed. The level of care is more geared toward the general population. I think we addressed that. Most of these facilities are not governed by state or federal agencies, so they do not meet criteria for health care facilities, yet they claim to treat mental health issues. I guess because they do have at least one licensed psychiatrist and some licensed therapists. The overall success of these centers is limited. Children and teens they are traumatized by the placement into residential treatment facilities. It's actually a shock, I think. Often they are placed in facilities by state agencies like Department of Social Services, which is true in my case because my daughter was an issue. She had an issue with being a danger to herself, while her cutting was few and far between, and it was very superficial at the time. They were concerned about her safety, that she would accidentally cut too deep. And, I can see their point, but I disagree with residential treatment facilities, and she actually was receiving better therapy prior to starting these programs, and she was actually handling things a lot better, and now she's not. And then too, these departments, they don't know much about the child's history, his or her specific needs. They don't know much about the child at all other than what they're told, and oftentimes they don't listen to the parent who actually knows the child, because I know in some cases the parents aren't able to communicate, or they're not credible or whatever. So I mean, I understand that, but it actually slowed treatment down for my child in the beginning anyway. So my daughter was placed there through a court order, which states that my daughter was placed there because of her own behaviors, her out of control behaviors, through no fault of me personally. But that doesn't ease the fact that she's still in a residential treatment facility, and I worry about her safety every day because she's had more incidences in the facility with the so-called trained staff supervising her around the clock than she ever did with me, and the injuries are worse. She keeps going to a new extreme. So what actually occurs in the RTCs, residential treatment centers, is substantially different than the extremely structured and individual programs that they advertise. It's not like that. They're not individualized. They're all categorized into a group, and it's pretty generalized. I just know that from experience. The environment places the children where all of their peers have issues of their own. They're all troubled, and this poses a risk for later behavioral problems. Research suggests that some children who are exposed or who have been around disturbed behaviors of others are more prone to displaying antisocial or bizarre behaviors themselves, such as mimicking. Cite my daughter as an example. In day treatment, about 3 days after she started day treatment, she befriended a girl who proudly cut cuss words into her arms and liked to show them to staff and other students. So about 3 days after that, my daughter did the same thing. My daughter started becoming disruptive, walking around the cafeteria at the school, screaming actually, who has a razor blade? I need to do this. My daughter just got increasingly disruptive, and her behaviors just increased, which is really why I didn't want her placed in a residential in the first place. That I knew it was making her behaviors worse and not better. So the children are also alienated from their families, communities, and support systems. Per the center policy, visitation is only allowed for 1 hour a week, and where you sit in a cafeteria setting with your child and someone overseeing your visit. So it's not private. You're not able to see them much. Phone calls are virtually non-existent. So your child is alienated from you and you from them. The distance to and from the centers is pretty far. I think I spend about 2.5 hours each way, so 5 hours to drive there. And with the parental work schedule and other family commitments, if you have other children, it makes family therapy difficult or impossible. Now, while the center will tell you they'll do family therapy over the phone, they don't. They just don't call. They'll come up with a zillion reasons why, and they just don't do it. So, and family therapy is an important part of treatment, because the child, my daughter, will be returning home to me, and I need to know from a professional standpoint how to handle her, but I think I'm going to have to find that elsewhere through a private therapist, because the center's not, working out. But when they do leave RTCs, they do return to the original environment, and most likely that environment hasn't changed. So the children aren't being taught how to navigate their environment, but are rather being alienated from it, and they say they're learning skills, but they don't get to put those skills to practical use by the restrictive environment they're in. So studies show that 50% of children who were admitted into RTCs were readmitted. Children are abused in RTCs. Most programs utilize physical restraints, but the ones who are doing the physical restraints when a child's behavior gets out of control or whatnot are the staff members who spend most of the time with the children. And those are the ones whose qualifications are very limited. They only have to be 21 and have a high school diploma. So they're not trained, and they do lack life experience. So injuries occur often. Medication is either used inappropriately or it's overused. I'll just cite the fact that my daughter was given 2 flu shots within a 3 or 4 day period because of their lack of record keeping. They lost the original flu shot record. Sexual abuse occurs either by staff members or by other residents. A lot of those staff, like I said, supervision is not as extensive as you would think. The opportunity for these kids to go AWOL, self-harm, hurt each other, and whatnot is a lot easier than you'd think. And my daughter is a prime example of that. She's been AWOL several times. She's self-harmed over there worse than she ever has. The glass incident. And most of these residentials are a private billion-dollar industry costing upwards of $700 per day per child. And most of the time, outside agencies are the ones who pay the bill, like Medicaid or Department of Social Services, which is the case with my daughter. And nearly 1/4 of children's mental health is spent on residential treatment facilities. There are other alternatives. For the juvenile offenders, in-home confinement, the ankle monitor, evening reporting centers such as like they do in probation or parole, acute crisis centers. Those would be the ones where in an acute situation you could take them into the center and get immediate care, and once or immediate, some better form of supervision, then once the crisis is passed, they go home. Certain foster cares, along with intensive therapy for all the situations. Residential treatment centers are not acceptable forms of treatment, especially for those who suffer with mental, behavior, or emotional problems. In fact, research suggests that these centers do not successfully treat the conditions that originally brought these kids there, but actually can create more problems or make the original problems worse, such as the case in depression, causes depression or makes depression worse, suicidal ideations, mimicking behaviors, that would stand true in the case of my daughter, uh, and so on. Most of these facilities are not accredited by federal, state, or local agencies, and therefore they are not governed. So nobody's watching over them. There's no watchdog. There's no one there pointing out rules and regulations that these facilities need to follow. So who's looking out for them? So in conclusion, I just want to reiterate, they're not acceptable forms of treatment. What they state in advertisements and what they claim to offer is different than what they actually offer, and they're not successful. That concludes my persuasive speech. And again, I want to apologize for my lack of audience. We had a death in the family and returned home from the funeral not too long ago today. So thank you.